Hello, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Jeannie White is the producer and writes the blog. Lillian Caldwell is the CEO. Passionate World Talk Radio, where we educate, enlighten, and entertain. I can't believe it's December. As you know, folks, you heard in the news that a COVID vaccination's coming out. Well, I have one of my favorite guests with me today, who you have heard before, and if you haven't, I suggest you look back and listen to my guest. My guest today is Arthur Wernick. He's a clinical pharmacist, and his expertise is in medication therapy management. And Arthur's going to talk about COVID vaccination and what we should know about it. Thank you, Arthur, for coming back on Chatting with Betsy.
Oh, thank you. It's a pleasure to be here with you and your listeners.
Appreciate you coming on and sharing your valuable information. So what should we know, Arthur, about the vaccination coming out?
Well, I thought I would really just start with the most recent information that's available, and this is a very dynamic situation because things are constantly changing. But 2 weeks ago, that would be mid-November, one of the vaccine developers, Moderna, reported a 95% efficacy rate for its vaccine, analyzing the results from only 95 patients. Now, it would be helpful to define efficacy means the percent reduction in the incidence of disease. It simply means that. Now, yesterday, on November 30th, they reported similar results in a 30,000-person trial. So there are things that we know, there are things that we don't know, and there are things we're not sure of. What we do know from the reports of this trial is that of the 30,000 people that were involved in it, half of the people got the vaccine, half of the people got placebo. Of the 15,000 people in the treatment group, the people that got the vaccine, 11 of them got COVID-19 symptoms. Of the 15,000 people in the placebo group who didn't get the vaccine, 185 patients got the COVID-19 symptoms. In addition to that, in the treatment group, 0 patients, no patients got serious disease. In the placebo group, 30 patients got serious disease. Now, there's also been talk about the Pfizer vaccine, which reported similar efficacy in its trial of 45,000 people. So both vaccines, and this is really interesting and very positive, both vaccines are equally effective regardless of age, gender, ethnicity, or risk of disease.
Interesting. Arthur, with this vaccination, can you take it if you are allergic to eggs?
Yes.
Like with the flu vaccine, you can't take it? Okay.
Completely different technology, completely different components. Mm-hmm.
Okay.
Now,
Thank you.
There are things that we don't know about the results so far. We really don't know the length of protection from the vaccine. We don't know if it will require an annual shot, or how long the protection lasts. We don't know about the risk of reinfection. And very importantly, we don't know the potential for long-term side effects of the vaccine. And there's a little bit to this when it comes to long-term side effects, because it takes at least 6 months to 2 years to observe the long-term effects. You simply can't push the calendar on something like that. We have to wait and see as time goes on if there are any long-term effects. Now, historically, long-term effects from vaccines can be completely independent of any short-term effects that a patient may experience. And we'll talk about some of the short-term and long-term side effects as we go on. Now, an important reason, on a positive side, an important reason that long-term effects may not be a concern is that once the vaccine's been given, it's designed to create an immune response in our bodies. Most people understand that. The actual vaccine deteriorates, and it is thought to no longer be active. it's our immune system that then goes on to provide the protection. So the idea is that there probably is not any lingering aspects of the actual vaccine in our bodies.
Interesting. Go ahead, Arthur. I was thinking, how there's a different flu shot every year, different flu vaccination every year. I'm wondering, will there be a different COVID vaccination every year? Or will it be like the pneumonia vaccination, you get it once every 10 years? I even heard on the news, I forgot which company it was, it will be a 2-part vaccination, the COVID. So this is so interesting, the information that you have. So thank you. Go ahead. I had to ask that.
Whether the vaccine is effective for any length of time is still not known. And so it's possible that its effect will dissipate just because it's not effective for a long time, or it's possible that there would be mutations that could occur that will require different formulations as time goes on. That's really not known yet.
Okay.
There's also a variety of things that we're not sure of. With Moderna's claims yesterday, with the information that they came out with, there still has not been any peer review from outside investigators, and that's normally a requirement for confirming the credibility of the findings. I think it was Dr. Fauci on television yesterday that said this data is interesting as a press release, but until you can get into what he called the granular data, where did this information come from? How reliable is the science? That still is not completely clear. We're really not sure of how quickly we can get enough doses to enough people. We probably need 2 doses per person worldwide, and the infections and illness will continue to occur. Now, I know yesterday they were talking about possibly getting 50 million doses out by the end of the year. But if that's 2 doses per person, it's going to still take a while. The other thing we're not sure of is, and this is starting to evolve as well, adverse effects, side effects after the first dose and side effects after the second dose. Those are potentially 2 different areas, 2 different realms of concern. Now, when the first dose, the side effects are very similar to what you might experience with a flu vaccine. Common to flu vaccines are swelling and discomfort at the site of injection, minor muscle aches, and a low-grade fever. Side effects after the second dose, here the early findings, the side effects in the second dose are a little bit more intense. And this information comes from both Moderna and an organization called the Advisory Committee on Immunization Practices. And that is an independent committee that advises the CDC. And together, they have created a variety of side effects that come from the second dose that are very distinct from the first dose. And pretty much in order of appearance, high fever comes in at about 2% after the second dose. 5% of patients experience joint pain. 5% of patients experience headache. 9% of patients get muscle pain, and 10% of the patients have fatigue. Now, these effects are being reported to be most severe in the, say, first 12 to 24 hours after the second dose. But they can be cause for a person to be limited for that 12 to 24-hour period. So a person may be limited in activity or work for 1 day after the second dose. Now, they are talking about healthcare workers becoming the first group, or among the first, to receive the vaccine, and that might be a concern in terms of impacting the availability of healthcare workers as they get the vaccine. And just for perspective, and I don't want to throw too many numbers around, but just for perspective, if we take the lowest percent of side effects from the second vaccine, 2% get high fever. If you vaccinate 50 million people, that's 1 million people that will experience that side effect.
Yeah, that is something to consider. And Arthur, do you know, okay, you get the first vaccine shot. How long do they wait to get the second one?
Well, between the Moderna and Pfizer one, they're talking about somewhere between 21 and 28 days apart. Both of those
okay.
Vaccines, yeah, both of those have the same technology. They use the same style of formulation and delivery. So they both have a lot of things in common. They're very similar in how they both formulate and how they work. So it'll be somewhere between 21 and 28 days apart for each one of those.
Okay, I was wondering about that, how that works with the length between the vaccinations, because I would think, my own personal opinion, if I reacted badly to the first vaccination, I don't know if I'd want to go back for the second one. Do you think that might be a problem?
It's a major concern, and it's being talked about. If a person has a side effect to the first one, how willing will they be to go for the second shot? Probably by that time understanding that the side effects could be significantly more inconvenient, if only for 12 to 24 hours.
Right. I mean, that would be a concern for me. I'm not working at this present time, but, you know, it's a concern for a lot of people. What about if you're a caregiver? I could tie any topic into caregiving. You know, that's a real huge concern for people. No, thank you.
The risks are something that researchers do look at. We have to keep in mind that there are risks of a new vaccine or any vaccine. And really, no medication or vaccine is completely free of risk. Now, to do a little deeper into this, it gets pretty interesting because vaccines are unique in that they're given to mostly healthy people, right?
Right.
So even though a vaccine may prevent serious illness or death, there is a low tolerance for significant side effects. And the more effective the vaccine, the less tolerance there is for even minor side effects. Now, let's look at it this way. You feel fine, you don't have any virus. You get the vaccine, and you continue to feel fine. You have no symptoms, no side effects, no disease. Perfect. Or, let's look at another scenario. You feel fine, you don't have the virus. You get the vaccine, you don't get the infection, but you do experience some side effects. It's the side effects you remember. So again, if a person experiences side effects from the first dose, will they return for the second dose?
Exactly. And with this vaccination, Arthur, do you know if there are limitations of who can take it? Can people take it if they have a heart condition or diabetes or asthma? Is there any restrictions, do you know?
Well, as we're getting used to hearing, at least in the media, it appears that people are at greater risk when they have other clinical conditions. It appears to be just as safe for people that have what they call comorbidities, heart disease, diabetes, high blood pressure, arthritis. It seems to be safe for those patients and seems to be more indicated for them that they are at a greater risk for developing a serious illness. As they've seen so far, among the patients that do get seriously ill, a large number of them have additional clinical conditions or diseases.
Right. I understand that. You have breathing problems, and you get COVID, you're going to be in pretty deep trouble.
Yes.
More so than if you don't have any, lung conditions or, heart condition. This is so interesting, Arthur. there is such controversy with vaccinations, such as, autism and the vaccinations. And, a lot of people are leery about taking new vaccinations. Personally, I don't know if I would take this vaccination. I'm too chicken. What is your opinion on taking the vaccination?
Well, when it comes to the risks that were, brought up many years ago about the potential for autism due to some of the additives in the vaccines, I think originally that wasn't taken very seriously, but the noise got louder and louder, and research began. And a lot of research has been done. And individually, I'm a scientist. I default to the published medical research. So many studies have been done that indicate that the additives do not cause those kind of problems. We have to believe in something, and I believe in the science.
Okay. So would you, in your own personal opinion, would you recommend people to get this vaccination or wait until more proof is out?
They ask people that on TV on those panels, and I just say what they say. Everybody has to make up their own mind. I would rather, I don't know. I would rather.
I know, I'm putting you in a hot seat there.
Well, I'll default to the data or the proposed data. I really think it takes 6 months to 2 years to see if there's any long-term effects. Theoretically, there shouldn't be. As I described a few minutes ago, the actual ingredient in the vaccine appears to dissipate, and the body takes over the protection, not the vaccine itself. It prompts a response in the body, an immune response in the body. So in theory, the active ingredients dissipate. They go away. I would think that it would be safe on the long term, but we just don't know. This is the first time a vaccine is being developed and utilized at such a fast pace. History shows us that haste makes waste sometimes. Studies on, if we remember, I'm going back in time, but thalidomide, DES, diethylstilbestrol, the polio vaccine gave people polio. Then they found out that it was much safer to take it as a drink, and we all stood in line to get a drink of the polio vaccine. Those things weren't evident until some time went by. It looked like a good idea at the time. That doesn't mean this is the case now. Our technologies are much greater. Our knowledge is much greater. Our science is much, much greater.
Right. I understand what you're saying. My own personal opinion, I told my son, that's your decision when it comes out if you want to take it, if it's available. Me personally, I'm going to wait. I want to wait and see if there's any long-term side effects, because whenever I do get a vaccination, I do get side effects. So I'm really petrified personally to try this vaccination. Wait and see, what happens with the health workers and whoever takes it. But, they could take up 6 months to 2 years to see what the side effects will be. That's 2 years of, the risk of getting COVID. So it's like, to me, a very, it's like between being a rock and a hard place. What do you do?
Right, and that's where we are right now. That's where we are. It is a difficult decision because as we see the numbers rise, we see that illness and possible death are increasing as time goes on. So we do have to make that both individual and collective judgment.
Right.
Acceptance of a vaccine it's an interesting dynamic. The confidence in a vaccine is based primarily on safety, okay? And then there's the individual perception of the likelihood of contracting a vaccine-preventable disease, okay? Those are both individual perspectives. Also, the population as a whole the perception of benefits and risks is a bit of a paradox, because the benefits are to yourself, of course, and to the population at large. But the risk is really only perceived as being to the self. So it's a difficult place to be in.
Yes.
But the relentless force of infection and illness and death, that could have a major influence on people's decisions. I think we're getting to the place now where most people know somebody that's been ill from it.
Yeah, that's true. My younger brother and his wife and one of their daughters just recently were tested positive for COVID.
Mm-hmm.
And my brother was over at my mother's house before he knew it. And even though they were at a distance, I don't know, if I was my mother, I would have said, stay home. That's what I would have done.
Yeah.
I love you, but don't come near me.
Right.
I could see you sometime next year. Arthur, I want to thank you so much for your time and valuable information. And you are also a personal pharmacist. Can you tell people how they could get in touch with you? Because, folks, I'm telling you, Arthur's the guy. He's the guy you want. Go ahead, you can share your information.
I like to try to keep it simple, email and telephone. My email is very easy. It's my name, Arthur Wernick, ArthurWernick, one word, Arthur Wernick @gmail.com. And my telephone number is 802-345-8804. And I'm willing to talk to anybody. As many people like to say, it's a free consultation. I love talking to people about their situations and trying to explore whether I can help them. Generally, what I like to do, my area of expertise as a clinical pharmacist is medication therapy management, and I do a complete analysis and assessment of a patient's entire medication use. I do it in coordination with their clinical conditions and their lifestyle, so I look at the whole patient and not just the medications. The typical patients that I work with have multiple clinical conditions or disease states, take multiple medications, 10, 15, 20 different medications a day, and are usually under the care of more than one doctor. My goal is to try to coordinate their care, try to reduce the amount of medications that they have to take, and improve the quality of their lives.
Sounds excellent, and I highly suggest, listeners, what do you have to lose? Just email Arthur, call him, and see if he can help you. It's worth checking into. I want to thank you again, Arthur, for coming on my show and sharing your valuable information. Folks, here on Chatting with Betsy, this is what you're going to get. You're going to get people coming on who have valuable information. You don't want to miss any of my shows. I am now on Amazon.com. It is free, Amazon Music, and wherever you hear podcasts, you will hear Chatting with Betsy. Please subscribe so you don't miss this important information that my guest has. Each and every guest has something valuable to say, and I just appreciate every guest that comes on. And the best way to fight against COVID, folks, wear your mask, wear, your mask. Some people wear gloves, social distance. Please be aware of that and wash your hands. That is the first line of defense, washing your hands. And, that's what we have to do. And as the flu season comes in, whether you choose to get a flu vaccination, that's your choice. But please, don't go over someone's house if you think you're sick or you think you might have COVID. Stay away from them, and you could always see them next year. But you won't be able to see them if you are not here or they're not here because you infected them. So please think of others at this time. And I want to wish everybody a happy holiday season this month of December. And that's all I have to say today, folks. Thank you for listening. Share this podcast. And until we chat again, this is Betsy Wurzel, host of Chatting with Betsy and Passionate World Talk Radio. Bye-bye now.